Okay, here we go with Interocclusal records. Now, we have adjusted our occlusal records, our record basis and wax rims, for, again, every patient. The record basis wax rim should be the same for every single patient. So now we want to go in and start modifying them. So one of the things we want to look at is we want to look at how much of their tooth is showing when their lip is at rest. Vig and Bruno did some studies where they showed about 1 millimeter for older patients, maybe a little bit less, closer to the level of the lip, as far as with patients. For our typodont or our simulated patient, we're going to use 32 millimeters from the top of the typodont. So you can take a Bowley gauge and mark 32 millimeters. Then in a patient, normally we'd want to make things parallel with the eyes and also parallel along the ala tragus or Camper's plane. And so we want to make sure our rims are following those planes. Also, whenever you're dealing with a patient, and if you follow Camper's plane, you're going to have a gradual inclination from the anterior to the posterior as far as the teeth. Your teeth should smile. Also, you got to be concerned about not only the corners of the lip, the buccal corridor, but also the curvature of the lip. So you try the Fox plane in, make sure you're level between the eyes, make sure you're level with Camper's plane. That's going to give you a pretty good occlusal plane to work with. For our typodont, you're going to, again, it's 32 millimeters from the top of the typodont. So the easiest thing at this point is just to take your Bowley gauge and carve it around at 32 millimeters. Now remember, this 32 millimeters is just an arbitrary number that we're using for the typodont. This has nothing to do with a live patient. So we mark that at 32 millimeters. Then you're going to take a hot instrument. Here we're using a large spatula type of an instrument, and it just allows us to be able to sear the entire surface down at once. But we've made our mark at 32 millimeters, and we're going to take it down to that 32 millimeters. Remember that when you use the Bowley gauge, that it is that the shortest line whenever it makes its little mark, so you want to make sure you completely eliminate that. Then you can come back in with your Bowley gauge, and sometimes even if the wax is cool enough, or warm enough, that you can actually use the Bowley gauge to carve the last little bit. So now we have our 32 millimeters, and when you look at it, it's going to give us a nice occlusal plane. The occlusal plane is headed to about approximately 2/3 up the retromolar pad. Our ultimate goal is we want to establish our vertical dimension of occlusion. For this project, we want to have a vertical dimension of occlusion of 60 millimeters. There's different ways that you can have the patient get in their rest position, and here are some options that you have. Once you have established that vertical dimension of rest, remember approximately 2 to 4 millimeters closed from that as vertical dimension of occlusion. So we want to adjust the rims on our simulated patient so we have a total of 60 millimeters. Now again, we're a little high right now at this point, and you can heat and soften the wax and close it down to establish the vertical dimension of occlusion that you want to have. That's one way of doing it. So we can close it down to that vertical dimension of occlusion. Or if we actually, for our typodont, since we want a total of 60 millimeters, and we've already set our maxillary rim at 32 millimeters, then we can just go up 28 millimeters from the bottom of the typodont. So if we go up 28 millimeters from the bottom of the typodont, that plus the 32 that we did from the top of the typodont to the maxillary rim will give us our 60 millimeters. So here I'm just taking the Bowley gauge. Understand, we would first establish a vertical dimension of rest in a patient, then we would arbitrarily close that down a couple of millimeters to establish a tentative vertical dimension of occlusion, and then we would want to evaluate it, making it sure that the patient, when they're at rest, the rims are not touching. Also making sure that whenever we have them count through their 60s or their closest speaking space, that they're not just banging the rims together. But for our simulated project, again, we're using some arbitrary numbers, and we want to establish a 60 millimeter vertical dimension of occlusion, so we want to adjust this rim down to 28 millimeters from the bottom of the typodont. That should give us our total of 60. So again, if you have the wax warm enough, you set your Bowley gauge at 28, and you go around, and sometimes if you just got a little bit of flash of wax that's left, you can actually carve that wax with your bully gauge. Depends on how well your lock mechanism works on your bully gauge. Okay, so once we've double checked everything, we make sure that our rim is 28 millimeters all the way around. Then we want to go back and reevaluate our rims and make sure that we're comfortable with our 60 millimeters. Okay, so we take our bully gauge and we set it at 60, and we check to make sure that it will fit over the typodon. So once we have established our vertical dimension of occlusion now at 60 millimeters, now we have everything established for our vertical dimension of occlusion. We have our occlusal plane. In essence, we are done with our rims. On a normal patient, this is the point where you'd start setting at least the central incisors, if not the anterior 6 teeth. Once you're done with that, then you want to put a couple of good notches on each side of the maxillary rim. Again, this is just to allow the registration material to index into these notches. So remember, they're not just small little notches, just like in the cast, you don't want to have small little notches. You want to have a couple of nice positive notches that when registration material flows into them, you will have a nice area for the material to interdigitate with. So we want to carve these notches on both sides. That's going to give us a nice record to be able to index with the maxillary rim, both with our coist-bow and also with our centric relation record, because it will be using these notches for both of those. And then what we want to do is you want to close the typodon down, and then just slightly anterior to the most anterior notch, you want to carve just a little line, just so you know where that position is on the cast. So you see I'm taking this longer buffalo knife, I'm carving a little line in, and then what you want to do is you actually want to take out approximately 2 millimeters of the wax. The reason for taking this wax out is because you're trying to create space for the registration material. We want to make sure that we don't have rim touching rim. We want to allow a little bit of room for the registration material so the registration material doesn't change our vertical dimension of occlusion whenever we have it in the patient's mouth. So see here, we have a couple of notches on the maxilla, and we've cut away a little bit of the mandibular rim. Now the problem with doing this is whenever you've cut away that part of the mandibular rim, the patient may bite on that anterior segment and cause some kind of displacement of the posterior rim, either having the mandibular rim pop up or the maxillary rim pop down. So what we want to do is we want to add a couple of little red wax cones, and that helps us to maintain a little stop back there so that the patient will not cause displacement of either of the prosthesis. Okay, so this is a time where it's good if you have applied a little Vaseline to the maxillary rim, because this will help the wax to not stick to the maxillary rim. Once we've gotten this on both sides, we feel confident as far as our vertical dimension of occlusion, then we are ready to take our centric relation record. So what we've done on this one side as far as establishing, again, the 2 notches on the maxilla, a little space cut away from the mandibular rim in this area, the 2 red wax cones. What I'm doing here is I'm trimming away a little bit of the red wax to keep it, so I usually like to keep the red wax out of the notches. And then once I've done that for both sides, then I am ready to add the registration material. Now remember, whenever you're with a patient, some people will put a little red wax dot on the posterior midline of the maxillary denture and have the patient lift their tongue up and touch that. You want your patient to reach their tongue up and touch the back of the denture as far back as they can. And then you're only putting registration material in the area where you created the notch for the registration material. You want to allow that anterior segment to come together. You want to make sure that you close it all the way. For your simulated project, you want to make sure and double check that you're still maintaining that 60 millimeters. And this material, the registration material, usually takes about 45 seconds to a minute to set up. So with a patient on the clinic floor, you want to make sure that they have their tongue again reaching the roof of their mouth as far back as they can, and they want to hold that position. Usually you have to hold the mandibular rim when the patient closes, and you want to hold that position for that 45 seconds to a minute. Then you want to open and you want to evaluate, and you want to be able to see those red wax cones sticking through. That just tells you, it's another visual to show you that you have everything seated all the way. So now you can use that mandibular registration and rim to mount your maxillary cast. Then we want to bring in the coisbow. Now usually you've set a couple of central incisors at least on a patient. Maybe you have set the anterior 6 teeth. But the thing about the coisbow is you want to make sure the patient's head is in a neutral position. You want that little white plate that you see on the tray right up against your rim if it's in the patient's mouth. And we'll show you that. We'll give you some demonstration here. So you put one of those white plates on the coisbow with the little vertical arm on it, and then you're going to put some registration material only in the posterior area. You want the teeth centered. There's a little notch for the center midline. You want the incisal edges down on the white plate with the facial surface up against that wall. You want to midline, put the midline of that rod in the midline of the patient's face, and then you want to center the coisbow itself level with the horizon, so both laterally and anterior-posterior, like you see here with the patient's head in a neutral position. For a simulated patient, we can do things a little bit differently because of the fact that we have a patient with no head. Some of the references that we would use are all parallel with the horizon, so we can use something a little different. The first thing you want to make sure is your pin is set at 0. Now on your articulators you do have 2 pins, and so make sure that second pin is out of the way. Then you want to put the coist table with that white plate on it. The little outer knob allows you to loosen it so you can raise and lower it. The silver inner knob allows you to raise and lower the table. You want to make sure that table is set to 0, and then you want to lock that outer pin in place so it won't go up and down. Then you're going to take that white plate, place it on top of the table, and that white plate has some markings on it. And the markings correlate to the coisbow that you're actually going to place in the patient's mouth. The only thing you're missing is any kind of a plane, so we will be sending these things to a relatively flat plane, whereas with the coisbow, most of the time you're going to have a little bit of an incline anterior-posteriorly with it. But there's a notch on the coisbow that orients things to the midline, and on ours we have this little midline line. We want to line that up with the frenum attachment, so we want to make sure that we're centered there with the frenum attachment on our simulated patient. Then this other line that goes across the anterior relates to the same thing as that white wall, so we want it just touching that. And then you want to look laterally here, and you want to position the cast so that it's centered relatively evenly, so you have an even amount of space on both sides. So once you have that even space on both sides, you have the facial up to that line, that anterior line, and then your midline is lined up with the central line. Then you're ready to take a mounting plate, put it on the articulator, making sure your pin is at 0 and your pin that's set at 0 is actually touching the table, and then you can go ahead and mount the maxillary cast in this position. This is how we can use it for our simulated project. So here we go using, here's one of those times where I am definitely going to use correct water to powder ratios whenever I'm mounting. You're going to take the mounting stone, you're going to mix it up. Obviously it's better if you have the water in the bowl first. It mixes the particles better. Then you're going to place some material into the mounting plate. And ideally you don't have to add a whole lot initially. You want to do one of two things. Most of the time you want to add just a little bit and then close the articulator down and then add a little bit more as almost a veneer. In this situation I've added plenty of material to cover the entire surface because there isn't a whole lot of room of space between this particular cast and the mounting plate. So I made sure the pin was set at 0, and now I'm just going through and I'm cleaning off the excess material that's flowing out. So once you get that cleaned up and looking nice, then you want to take off the coist table. You want to make sure that you have a new mounting plate on the mandibular arch. And the key here is that second pin. That second pin, I often see students having it too high and it interfering with the pin that's set at 0 touching the table. So you can see here how I've set that inner pin just slightly lower than the outer pin that's actually set at 0. This ensures the fact that whenever I close this articulator, that I'm not going to set the table down on that inner pin. It's going to touch the outer pin. And then with my registration material, with my my mandibular cast, I'm going to close it, ensure that that table is contacting that outer pin that's set at 0. So we know everything's set at 0. This is what's going to maintain our vertical dimension of occlusion. Then we want to mix up some stone, just as we've done before. And in this situation, there's plenty of room, so we're going to add some, again, to the mounting plate itself. And then we're going to add a little bit to try to be not as messy as I am here. You're going to mount a little bit place a little bit of stone on the actual cast itself. And then later go back in after that is cured, and then you can put a nice veneer of the material on there and make it look nice and clean and neat. So here we're adding some stone. You can use the elastics to hold the cast in place. Sometimes we've had problems with the elastics actually taking up too much space so that you don't actually have enough room for stone, and we've had some of our mountings come off because of that. So that's why you see in this particular demonstration I am actually holding the cast in place to ensure that the maxillary and mandibular cast stay in intimate contact with each other. I'm just cleaning out a little excess material, but you want to make sure that the table stays at 0. So here we have everything mounted, everything's in the articulator, we have our pin set at 0. We are now ready to set some teeth on our simulated patient, which is what we're going to be starting to do next week when we talk about anterior teeth.